So we're here on a sunny winter day
Indeed.
in March of 2019 with Lynda Young, and you were president of the Massachusetts Medical Society from 2011, 2012.
That's right, yes.
So what was on the front burner then?
The biggest thing was payment reform. The legislation was being formed. And the exciting part about that is that we had a seat at the table while that was actually being written. At that time, Judy Ann Bigby was the Secretary for Health and Human Services, and she ran the meeting, but it was all kinds of people representing all kinds of people. And so I got to Ashburton Place way too much, but it was really interesting to see the different wishes that people brought to the table. Obviously, it wasn't going to be unanimous. It was going to be by consensus. So that's what, and I can't even remember, was it Chapter 224, I think, was the bill?
Not sure. I mean, there was Chapter 58 was the initial healthcare legislation in 2008.
Right.
After that, I'm not sure.
Right. So universal coverage was 2006.
Yeah.
So that's what we had. It passed in 2012.
Yeah.
And then the other big issue became physician-assisted suicide.
Yeah.
And I started it, started being the representative for that. And then Dick Agababian came in as president, but he asked me to continue on with that because I had already done TV shows and radio and interviews and things like that.
So the payment reform is part of as our conversations with your predecessors have evolved, basically there are a couple of big ideas here. One is that Massachusetts is innovating with regard to healthcare delivery, and in some ways setting an example that later was copied by the federal government. The second is that in Massachusetts, the first thing that was tackled was access.
Yes.
And the idea that everyone should have coverage. And then following that, rather predictably, the next thing would be reform in the way it was paid for to try to align inflation in healthcare with general inflation as well.
Yes. And the other thing that came out of that particular legislation was the creation of the Independent Oversight Agency, the Health Policy Commission. So that was interesting because they were going to look to see if they could keep costs down, mainly with all the mergers that were on the horizon, and whether or not that would actually be helpful or increase costs.
And so we also are practicing in an era in which there is both vertical and horizontal integration. You have hospitals that were taking each other over or whatever and consolidating. And then in addition, you had hospital systems that were acquiring physician practices and outpatient delivery healthcare delivery centers and essentially trying to vertically integrate the delivery of healthcare.
Right, right. So it was very interesting. And coming from my background with a small independent practice, it was, what? What's going on? But it was really an honor to sit and represent the medical society. And of course, staff was right behind me, helping me with issues and such. But I also made some interesting contacts, and which I'm still in contact with some of these people. So because of all those meetings, but also that we shared the same view, and if we didn't, we understood why we didn't. So it was really professionally a great experience.
Okay. And during your time in office, what sort of innovations were introduced with regard to payment reform?
I think most of it, I think the commission was probably a big thing because there aren't very many states that have that.
Right.
They also took a look at, keeping it within 3% of the gross can't even remember what that stands for anymore.
Well, it could have been the gross domestic product,
That's
or it could have been
GDP.
General inflation.
It was gross domestic product.
Okay.
To keep it within 3% of that.
Okay.
So I think that was pretty innovative, and so it gave you wiggle room because you knew that prices were going to go up.
Right.
But so it gave you some wiggle room, but it also set a ceiling for you. So whether it got listened to or not, another issue.
Now, simultaneous with this, they were introducing healthcare legislation at the federal level as well.
Yes, yes.
And did that affect you, or did that affect the practice of medicine in Massachusetts?
Oh, I think once it, oh yes, I think once it got passed, it definitely did. I mean, this was when President Obama was putting through his Affordable Care Act. And again, modeled after, pretty much modeled after our Romney
Right,
Care.
right.
And I think it did have a profound influence on everything. Yes. The payment business that we did was really pretty much very separate because the ACA didn't have a lot of meat as far as that issue went. So,
And another thing that was going on was some experimentation with regard to Medicare, dealing with what they were referring to as accountable care organizations.
yes.
Did that come onto your plate at all as president?
A little bit. It did definitely with the payment reform legislation.
Right.
And I remember one of the big things was we were sitting in a big room, and there were a lot of people at the table and a lot of people sitting like in the audience. And everybody was talking about ACO, ACO. And so one guy said, you know, everybody knows what an ACO looks like. It's like a unicorn. Everybody knows what a unicorn looks like, but nobody's ever seen one. And so that was pretty true in those days. Now we're seeing them, and we see how they work in some instances. But I think the fallout from all of that's going to take a few more years.
Well, one of the big concepts involved there was with integration of healthcare delivery with these systems, that they could then shift risk from insurance companies over to the healthcare system, and in so doing, apply more pressure to those delivering care to keep costs down.
Yes, and definitely shifted it to providers. And you know how doctors are very risk averse. So it was a lot of effort to get people to understand them,
Yeah.
and definitely to become a part of them.
And yet, you know, if we look at typical medical education and residency and postgraduate education of various sorts, there isn't a lot in there on handling populations or on dealing with information systems or even on dealing with the statistics that you have to be able to understand to model risk.
So population health was actually the focus of my presidential CME program for the annual meeting, the secret sauce. And that's, yes, so that was just starting to get some momentum too. So that was probably another issue that was just starting up.
Right. And I think to acquire the information you need to be able to deal with risk in an analytical way, you basically need a data set or a database that is reliable. And simultaneous with all of this is the introduction of electronic health records, which had a lot of promise, may not have
Sure
delivered quite as much.
Right, yes.
So,
Yeah.
oh well. So also you had a focus seemingly quite separate really on physician-assisted suicide. Tell me about that.
So that came as an issue. There had been, because we had a policy then that we were opposed, and there was an attempt at that time to change that policy. And it got a lot of attention in the media. I remember being on NPR with Kaylee Crossley, I think that was her name.
Yes.
And it was a debate between myself and Marcia Angel. And Marcia gave a very heart-tugging story about her father who committed suicide when he was dying, and how awful that was and how wonderful it would have been if there had been something legally that could have been done by his physicians. So I'm representing the medical society and had to give, you know, the biggest thing that was and the other thing that I forgot to mention is that there was a ballot question. And that was the other thing, the ballot question that came out. And that, the ballot question probably was the real instigator of all of this. So wanting the populace to decide whether or not our state should have physician-assisted suicide. So because we're against it, that's what I went and represented. I was also on Jim Braude one night The
You
interesting
had
part.
a cable TV show and a
He did.
PBS show.
Yes, yes. So I was on the cable TV show, and in that proposed legislation on the ballot question was you had to have a diagnosis that you were going to die within 6 months. So it was very easy in a way, it's kind of macabre, but very easy in a way to bring that out to your, to our side's advantage. And I always would use Senator Ted Kennedy, who, when he was diagnosed with his brain tumor, was given 6 months to live. And he lived 17 months, and during that time passed his significant federal health care legislation. So, you know, why would you put something like that on there? And honestly, that was a very convincing argument for a lot of people.
So now, you know, these rather technical health policy reform issues that were coming up, and the issue of physician-assisted suicide, you being a pediatrician, probably these weren't things you encountered a lot
No.
in your day-to-day life. And
No,
so
not at all.
what kind of staff support did you receive?
From here, from the Medical Society, it was phenomenal. A lot of it was talking with people. A lot of it was getting information and getting the information about other states. There were few other states that had legalized physician-assisted suicide. So they were able to give me a lot of background information. Also, for the interviews, the media department was really very, very helpful with saying, you know, so-and-so's on the phone from NPR, and here's what they're going to try to trip you up on. So they were very helpful. And unfortunately, I used to use my cell phone a fair amount, and the Globe reporters seemed to keep my number.
Well, but you do point out the fact that there's a, you know, with healthcare becoming more and more involved with large organizations that are very well capitalized, with government and the like, that there's a real need for good public relations. There's a real need for technical research and advice to allow us to be effective spokespersons for the medical society.
Definitely.
And that support was there for you.
Absolutely.
Yeah, they have a legislative department, a health policy department, public health, plus
Media.
communications that were
Right.
remarkable. Excellent. Any other thoughts regarding your presidential year?
I had a speechwriter.
Yeah, that's amazing, isn't it?
It was wonderful, yes.
Yes.
And my speech used to be handed to me in a speech box.
Yeah.
And a very nice box.
Yeah.
And I would work with them, and they would, when you first come in as, I think they start talking with you as president-elect because they want to get your style.
Right.
They want to get how you speak and,
Right.
and that sort of thing. And they get very good at writing the way, and I would change it a little bit because I said, yeah, that's just not me. And so they got very good at understanding that.
Yeah, capturing your voice.
Yeah.
Yeah,
And people
that's
would
great.
say, oh, that was such a good speech. And I said, oh, thank Frank, because I didn't write it.
Right. Excellent.